What is bladder cancer? Bladder cancer is one of the most common cancer affecting approximately 68,000 adults in the United States each year. Bladder cancer occurs in men more frequently than it does in women and usually affects older adults, though it can happen at any age. Bladder cancer most often begins in the cell that line the inside of your bladder, the hollow muscular organ in your lower abdomen that store urine. Although it is most common in the bladder, this same type of cancer can occur in other part of the urinary tract drainage system. About 7 out of every 10 bladder cancer diagnosed out at early stages. When bladder cancer is highly treatable, however, even early stage bladder cancer may recur in the bladder. For this reason, people with bladder cancer typically need follow up tests per year after treatment to look for bladder cancer that recurs or advances to the higher stages. What are the symptoms? Bladder cancer sign and symptom may include blood in urine, painful urination, pelvic pain. If you have such kind of symptoms, then you are suffering from bladder cancer. If you have hematuria, your urine may appear bright red or cola color. Sometimes urine may not look any different, but blood in urine may be detected during a microscope exam of the urine. People with bladder cancer might also experience back pain, frequent urination, but these symptoms can occur because of something other than bladder cancer. What are the causes of bladder cancer? Bladder cancer develops when the cells in the bladder begin to grow abnormally rather than grow and divide in any orderly way. These cells develop mutation that causes them to grow out of control and not die. These abnormal cells form a tumor. What are the causes of bladder cancer? It include smoking and other tobacco use, exposure to the chemical, especially working in a job that require exposure to the chemical, past radiation exposure, chronic irritation of the lining of the bladder, parasitic infection, especially in the people who are from or have traveled to certain areas outside of the United States. What are the types of bladder cancer? Different types of cell in your bladder can become cancerous. The type of bladder cells where cancer begin determine type of bladder. The type of bladder cancer determine which treatment may work best for you. Types of bladder cancer include urethrothelial carcinoma. Urethrothelial carcinoma, previously called transitional cell carcinoma, occur in the cell that line the inside of the bladder. Urethrothelial cell expand when your bladder is full and contract when your bladder is empty. These some same cell line the inside of the ureter and the urethra, and the tumor can form in those places as well. Urethrothelial carcinoma is the most common type of bladder cancer in the United States. Squamous cell carcinoma. Squamous cell carcinoma is associated with the chronic irritation of the bladder, for instance, from an infection or from long-term use of urinary catheter. Squamous cell bladder cancer is rare in the United States. It is more common in a part of the world where certain parasitic infection is common cause of the bladder infection.